let's get cracking. Welcome everyone to the NPAA and Nursing the Nurse webinar on Burnout to Balance. We are here today to build your wellbeing blueprint and ultimately help you create a bit more work-life balance, because I know nursing is tough, guys. We know this. It's definitely nothing new. So I'm going to be jumping between my slides and video because I'd love to interact with you guys. As Jordan was saying, this session is recorded. So if you don't want your video to show up or your voice to show up, recommend you stay muted and video off. But if you'd like to interact with me, because I'm going to be asking you a couple of questions where you can, give me a thumbs up or a yes or a no. So if you want to interact with me on the video, then you're absolutely welcome to do that. We do have, as far as I'm aware, and Jordan, you can confirm this for us, we do have the settings set that you won't actually be shown necessarily if you're not speaking. So just confirm that for us,
Correct.
Jordan, and then I'll get our slides up. Amazing, cool. So we'll get our slides up. Alrighty. Perfect. Amazing, I can see your beautiful faces. Wonderful. Alrighty, so I know that many of you are tuning in probably already running on empty, and I want you to know that you're not alone, because today is your time to just pause and focus. Take a minute to focus on you. We are so hardwired to be givers, and we often forget that it's okay to become what I call healthily selfish. So yes, as for those who are still popping in, please share with us where you're popping in from. We've well and truly well spread across the country, so that is fantastic. And as we have said, that we are going to be recording this session. So by staying in the session, you consent to being recorded. If you'd like to ask any questions during the Q&A section later, what we're going to get you to do is either just raise your hand like this, or do a react of raising your hand, and we'll get you to unmute at that time. I think Jordan might actually be able to mute and unmute you guys so that we have a really clear recording for those who can't make it live. All right. So many of us know that burnout is something we all see all too often in nursing, and that's why the NPAA and myself from Nursing the Nurse have teamed up to provide this webinar and session for you guys. So the great thing about NPAA, and this is why I decided to partner with them and approach them for this opportunity to speak with you guys, is they provide fantastic service through their case managers. They specialize in helping nurses to recognize those early signs, those early warning signs, and the tiny red flags of burnout, so that you can get that support before things reach a crisis, before you feel like you just need to leave an industry because you just can't keep going any longer. They also include, fantastic resources such as guides. They guide them through using their entitlements, using their sick leave wisely, especially when it's really needed. How often do we call in sick because we just need a mental health day? And that's just the reality of it. So they also assist with your flexible working arrangements, like negotiating them, drafting applications to support you in meetings, and they even represent members if requested when they're unfairly dismissed. The kind of support that NPAA provides its members is making sure that nurses can protect their well-being and continue to deliver the best possible care. So yes, if you're already a member, you already know this stuff. You don't have to, you never ever hesitate to reach out for support, because they really are fantastic to deal with. And if you're not, and you are new to the NPAA, now might be a really good time to consider making that switch. So we'll be talking a bit more about that later. All right. So I just want to quickly see if we've got anything new in our chat, and then we'll continue on. Amazing. We've got, again, Brizzy, Townsville, Sydney, Carrum Downs. Currently in Perth, Alan, but you work in Hobart. I love it. ACT. Alrighty. Fantastic. Yes, they do know you by name, Janine. I love that. Fantastic. Alrighty, let's get into it. So, where's my next slide? Now, before we get into the nitty-gritty, if you've ever thought, that you wake up and you feel tired and you're like, my shift hasn't even started, how am I going to face this one? You're not alone. That's why this session exists. So I need to get your permission for something. I'm just going to stop sharing for a second. I need to get your permission, because if you've not really already noticed, I get really, really passionate. So I need your permission that if I talk quickly or I, go from topic to topic, that you'll keep up with me. Is it okay if I bring that sort of energy today? And I'd love to see some hands if that's okay. Let's see some hands. Amazing. Thank you, guys. And today I'll be sharing a little bit more about how you can build your own well-being blueprint. Thank you, guys. I appreciate that. And it's a very simple tool. So I'm going to be sharing with you the strategies to stop surviving and to start thriving as a nurse, as a mom, partner, person, and being, really. How does that sound to everybody? Get a show of hands again. Fantastic. Alrighty, because I reckon that'll be a good use of our time because we've only got about an hour. So yeah, let's get it done. Also, at the end, for those who want more support, is it okay if I take 5 to 10 minutes to just share how we can keep working together? Is that okay? Amazing. Fantastic. Alrighty. So let's get into our learning objectives, because ultimately, we love multitasking. So why not crack out an hour of CPD while we're at it? So by the end of this webinar, participants like yourselves will be able to define burnout in nursing. You'll be able to see a little bit, understand a bit more the impact on personal well-being, not just from personal experience, but from a stats point of view, because the stats really are quite scary when you look at them. You'll be able to recognize the limitations of generic stress management strategies and why nurse-specific approaches are required. You'll be able to identify the 7 essential well-being domains of self-assessment. You'll be able to start looking at how you can apply micro actions to create a bit more momentum and work towards that work-life harmony. And then you'll also be prompted with some really great questions in our workbook, which, by the way, you either would have been emailed that, and I believe that Jordan can pop that in the comments for you guys as well, comment section for you to download and follow along. Excuse me, so that you can reflect on how you can integrate these principles that we're going to be learning today. Okay. So what is burnout? Many of us know this already. It's a syndrome resulting from chronic workplace stress that has not been successfully managed. And that is a reference or a definition from the World Health Organization. A couple of really basic and extreme symptoms that you might notice is feeling exhausted, feeling overwhelmed, feeling negatively about your work. Other things also include things like cynicism, and you can also notice a reduced professional efficacy and not quite showing up the way you used to. So interestingly, burnout is now included in the International Classification of Diseases, or the ICD-11, as an occupational phenomenon and not as a personal failure. So there you have it, ladies and gentlemen. It is not our fault. We don't know why it happens. What we do know is that we don't have a way to move away from it yet until some systems like what we're going to learn today start becoming more prevalent and we start implementing that. So nurses face much higher rates due to the emotional nature of our work, of shift work, staffing shortages, and these stats just haven't improved since forever, really. It just keeps progressively getting worse. So I used to think that being tired and stretched thin was just a part of the job, and it's just not. So let's learn a little bit more about the stats, and then I'll share a bit more about how I came to know what I do now. So in the 2022 Annual Health Professional Survey, the Mental Health Australia runs this every year. They found that burnout rates have continued to increase from 80% in 2020, which we know why that happened, and it's just continued to steadily increase. And in the latest one that we have published is 86% of nurses experiencing at least symptoms of burnout, which is a staggering statistic. You can see there, they have a small breakdown of healthcare workers experiencing burnout and like the symptoms that they reported, which is just really interesting for you to take note of. But another thing is that the Australian College of Nursing have found that nurses is one of the top professions at risk of burnout, and it comes as no surprise, especially as we're seeing the lack of support for our kind. I always say that we are a unique breed of people. So yes, anyway, burnout is also interestingly linked to not interestingly, but if you think about it, burnout is linked to increased medical errors and decreased patient safety. And that was from a study done in 2016. So that's even pre-COVID. And we know this because we are in it. But I think often we kind of forget that it is such an important aspect of our health and well-being that if we're not looking at the impacts of it and how we are showing up as a result and dealing with it at a core point of view rather than just at treating the symptoms, this is going to keep happening and our patient care is going to suffer. So if you've been thinking, let me see you guys again. It's awesome to see you guys. So if you've been thinking that I can't keep doing this and that thought has ever crossed your mind, you're not alone. I'd actually like to see who has at least had that thought in their mind that you're just like, I can't keep doing this. And the reason, yeah, exactly. I love that comment, Janine. Cynicism, no way our nurse is cynical. Yes. Yes, look, so this is what we're here is that framework. The framework that we're going to go through now is what helped me reclaim my energy, my joy, and my presence, not just at work, but also at home. So for me, what happened was I was 6 months into my nursing career when I reached burnout. And what happened was I was noticing that the older nurses on my ward were all of the above symptoms that we mentioned and then some. The talk in the break room was always about, I'm going to quit. I can't do this anymore. You know, shift work is kicking my ass. Sorry for those who think that's a swear word. I'm sorry. You know, it was really, really tough. And I just realized, hey, I do not want to see that happen for myself. I'm 6 months into my career. How on earth am I going to manage this 5, 10, 15 years down the track? I love nursing. I don't want to start resenting the career that I love. I was being guilt tripped into working doubles. I was binge eating those delicious chocolates at the nurse's desk. How often that happens. I really, really couldn't sleep. I was lying around, tossing and turning at night. I'm going, oh, I missed that. Oh, I should have done that. Oh, you know, what could I have done better? Beating myself up, really. You know, I'd walk in the door and just snap at my family. And these were the types of things that I was like, red flag, what is happening? And I approached my clinical nurse educator at the time and I said, look, I'm noticing these things. What can I do to prevent it? And she looked me dead in the face and she said, look, it's not going to change. Get used to it. And I was like, well, that was the best advice I've ever received. Thank you. Now, the type of person I am was I wasn't just going to let that lie. And so instead of letting that happen to me and become my reality, I set out on a very determined journey to find what could actually work for me. And what I found was there really were no resources or very, very little resources available to nurses to actually be able to apply it. You know, there was like CEO hour of power at 4 a.m. in the morning. And I was like, well, there's no way you're getting me out of bed at 4 a.m. in the morning. And, you know, that's just one example. It just wasn't tailored. So I took bits and pieces from courses and books and you name it. And I weaved it all together to write my book called The Ultimate 6-Step Guide to Beating Nurse Burnout. And that I published in 2023. I then adapted that into a course and all that jazz. So if any of you, who here is into personal development? Who has heard of the Wheel of Life? Amazing. We've got a couple people. Yeah. So I'm going to share a little bit more about what the Wheel of Life is in a second, Karen. So the Wheel of Life is a really, really popular personal development tool for anyone. And I'll share with you the name in a second, but I'll just finish this thought, Erin. So the Wheel of Life looks at all aspects of life. But what I decided to do is I decided to create a mini version of that Wheel of Life called the Mini Wheel of Life for nurses, which covers 7 domains in like a framework that really helped me shift to create that work-life harmony that we're talking about. It's not just about one thing or the other. It's about looking at the whole, because I often say that self-awareness leads to self-care, leads to harmony. Thank you so much, Bryce. Yes, so it's the ultimate 6-step guide to beating nurse burnout. All right, so let's look at what is the difference between balance and harmony, because you'll hear me say work-life harmony rather than work-life balance, because I believe that work-life balance is a myth. So work-life balance, what does it mean? So when we say balance, often we think 50-50, and that's just not the case. We know this. If we've tried it, some people manage to get that working, but it's really, really tough unless you're working casually, working for yourself, or working in, I'm sorry, I'm going to throw you guys under the bus, a day clinic or GP practice. It's really easy to do that because you've got a really predictable schedule. When you're not in a predictable schedule, as the majority of nurses are, harmony is way easier to attain, because what that means is there's a dynamic flow of, it might be 80% of A and 20% of B, whichever that way looks for you. Like, obviously any ratio works, but it's ultimately about finding what's going to work for you, because what works for one person won't work for another. Again, we know this and we apply this to our patients, and yet we try to push ourselves into this little box of 50-50 work-life balance. So as nurses, we're told that it's just the way that it is, or just to toughen up, or just to deal with it, or find another way, quit, go do something else. You just weren't made for it. You're just not cut out to do it. And the reality is that we just haven't given ourselves the space to actually achieve what we need to achieve. Okay. I don't know about you, but if you went to university to train, I saw earlier that we have a couple of, I like to call you guys veteran nurses. You've been in the industry for a good long while. For those who did hospital training, I'm sorry, I don't know exactly what your training looked like, but those in uni, you have seen that they just drill into you patient-centered care. It's all about the patient. It's tailor it to their needs, blah, blah, blah. Also, PS self-care, but we're not going to tell you how, because there's no time, and also it's ultimately about patient care. So it's like, okay, well, you told me I need to do it, but I don't know how to do it. So let's look at the how. Okay. Why does traditional stress management not work? Well, let's be real. Taking a bubble bath isn't going to de-stress you for the long term. It might make you feel better in the moment, but it's definitely not going to set you up for long-term sustainability. So many might know about Emily Nagoski. She is a wellness educator, and she says burnout is the definition. She defines it as being stuck in a stress response cycle, and that's like that fight or flight mode. We've got a fantastic expert that I work with and that I share with the Nursing the Nurse sphere, and she is all about that stuff, and like looking at the nervous system and how that impacts our ability to show up in a cool, calm, collected way, even though we're not feeling like that on the inside. And we'll get into that later. So self-care cliches: take a bath, do some yoga, do a meditation. They don't work when you're depleted. You need to be able to fill that cup back up. And it's a cliche for a reason. So I like to use an analogy of a leaking bucket. So if you can see cracks in the bucket or cracks in whatever, we're talking about things like sleep, your nutrition, setting boundaries, the relationships that you're having, your purpose, like how you're connected with that. If those things are coming loose at the edges or forming cracks in that leaking bucket, it's going to keep leaking until you start patching it back up again, right? So the ACN did some research, and they found that, again, like I said before, nurse burnout is directly impacted or affects patient care and safety directly. There's the correct correlation. So when we're looking at recovering from stress, we need to start looking at going through that cycle of stress. And this is again from a study from Nagoski, where they found that there's a stress cycle. So if you're not familiar with the stress cycle, that's a webinar for an entire other day, but it basically just means that you go through the stages of stress, but you actually need to exit that cycle rather than continuing on in that loop. So other things, and we're going to get into those 7 domains in a second, one of them being or part of them being nutrition, sleep, and emotional well-being. But a study again found that when you've got poor nutrition, when you're not sleeping well, and when you're not able to deal with the emotional turmoil on the inside, it worsens your burnout. Many of us suffer from moral injury, because we're constantly living in contrast to what our morals are and what we're taught as nurses and what we stand for as nurses compared to what the reality is on the ward. Who can relate with that? Because I know that's really tough. Yeah, absolutely. Yeah, for sure. Yeah, no, it's so real. So this is my message. If you don't take anything away from this, you do not need more stress hacks. You need a structured framework to address the leaks, the metaphorical leaks. So without addressing all 7 domains, balance or harmony doesn't last. Okay, so what are those 7 domains? The 7 domains that I found work to help fill those leaks up. And we're now going to move our metaphor from a leaking bucket to a wheel. I want you to start picturing a wheel, and I'll show you a visual in a second. But our 7 domains is unwinding, the skill of unwinding, practicing self-care, getting good sleep, nutrition, looking at your habits. And yes, sleep and nutrition are habits, but I put sleep and nutrition as 2 domains by themselves because they are so, so important. And then our last 2 is our passion or purpose and your goals. Where are you going? So if you start looking at these, start thinking, where are your leaks? And we're going to start doing a bit of a joint exercise together. And this is going to help you bring that self-awareness that I was talking about earlier so that you can actually start taking action towards creating that change. So if you think about, I'm gonna explain each of them in a second, and then I want you to look at who's got I think the link was sent earlier, the workbook. I'm going to show you. This is our mini wheel of life for nurses. So if you look at these 7 domains as a wheel, and each domain as a spoke or as a pie in your wheel or a slice in your wheel, start rating yourself from 0 or 1 to 10, 1 or 0 being in the middle, and then 10 being the outer edge. 0 is no satisfaction or completely unaware or completely lost, to 10 being like, I'm smashing it, I'm feeling great, this is sustaining me. So I'll walk you through what each of those areas mean. So when we're thinking unwinding, how many of us, and I'll just go back to our previous slide, how many of us struggle to leave work at the door? Think about things like post-shift rituals to reduce that stress load that you might have built up. What about a meditation? I know let's call it the toxic unwinding practice that many of us might have or have had in the past, is to drink a glass nudge bottle of wine at the end of the night. We can see a couple of thumbs ups, couple of oops, you called me out. Look, my husband and I have a wine subscription. We love wine, but the reality is when you're starting to rely on that glass of wine, that bottle of wine, couple of bottles of wine to de-stress at the end of the night, that should be a red flag for you that it's not fully sustainable. The old practicing what you preach sort of thing as a nurse. We're practicing and we're preaching wellness and looking after our well-being. So, let's start thinking about that. All right. So post-shift rituals, leaving work at the door. When we can't leave work at the door, again, that's gonna leach into our sleep. It's gonna lead into our passion. It's going to leach into our relationships, which that is another thing that is coming into this. I'm doing a full revamp of this wheel of life, a mini wheel of life for nurses in the next few months, because relationships are massive, not just between nurses and co-workers, but also when we come home and dealing with our loved ones. Moving on to self-care. Like I said before, it's way more than just bubble baths. We want to learn of how to set real boundaries, how to learn how to say no, learning how to become, again, like I said earlier today, becoming healthily selfish. It's okay to be selfish. It's not okay to be rude about it, for a lack of better words. Sleep. How many of us work shifts and we have shocking night's sleep more often than not because we don't have a proper routine in our sleep? And I'm talking like 10-15 minutes before bedtime. Not practicing proper sleep hygiene. Again, for those who work night shifts, you might not have the proper structure in place. Like you might not have blackout blinds, or you whatever, like you had a coffee like 10 minutes before you went to bed thinking that it doesn't affect you when I can tell you it does. It's basic things like that. Looking at nutrition, for me, a big one was those darn snacks at the nurse's desk. My goodness, I was like, I was getting my scrubs were getting tighter and tighter. And I was like, I need to stop, and yet I need that sugar rush because I need to feel better right this second. And so something that I learned really quickly was learning how to control my blood sugar through diet, and that's why we've got a fantastic nutritionist and dietitian team at Nursing the Nurse, because like, how do you do that when you're working shifts, especially night shifts, like those 2 to 4 a.m. munchies? My golly, they get me all the time. So and then obviously with nutrition, we are prone to having our metabolisms impacted, right? So how do we nourish our bodies through those really stressful times when our circadian rhythms are everywhere? So that's really important as well. Other things is our habits. And I also incorporate movement and habits into this. And by movement, I mean, think exercise, but think movement with purpose. So it might not mean you're doing a formal, and I think I saw someone earlier say something about yoga, I'll break my hip. You know, instead of thinking, oh, I need to do this formal exercise session, how can I incorporate daily movement in exercise? So again, we know basic things like taking the stairs instead of a lift, but there are other ways that you can do that as well. Other things that when we're thinking habits is like our water intake. Again, we've got a big one with that where we're just dehydrated. We call it the nurse's bladder. I call it dehydration bladder. You know, yeah, something to think about as well. All right, last two, and then we'll go into this exercise is reconnecting passion. So we're looking at passion. So we want to think about how do we reconnect with what got me to do what I'm doing again. Many of us are just in this, I don't know, slog or just head down, bum up mentality of I just need to get through this so I can retire and be done with it. But wouldn't it be so much better if you could actually reconnect with that initial little fire that got you started in nursing in the first place? Thinking back to your beginning days, student nursing days, or even early career days where you're like, oh, I love this. To be fair, most of us still have those moments pop up, but there are a couple of times when, you know, you might go through a stretch where you're just like, no, it's not for me anymore. Maybe I'm just not cut out for it. And our last one is goals. So this is some people might think that this is something that's like, oh, goal setting, blah. The reality is if you don't know where you're going, you are just going anywhere. You know, it's a difference between putting into a GPS, I want to go to this exact address compared with I want to go to the area or the suburb that it's in. You might actually reach the opposite end of that suburb, or you might actually reach an entirely different suburb for that matter if you don't have any destination. So even if you don't set yourself a proverbial address of where you're going, you are going somewhere. The reality is for you to start thinking about is, am I going where I want to go? Okay, that's why that is important. All right, so let's do this exercise. I'd love for you to start dropping in the comments where have you rated yourself? And you don't have to share each aspect, but perhaps we can start. You can share what is your lowest and your highest scoring, and how is that starting? And you can start thinking for yourself, how is that going to help you bring awareness to, oh my goodness, like I didn't realize I was this low or this high in this many or few areas. Let's start seeing. So who scored between I don't know, 0 and a 10 for, let's start with sleep. So yeah, on a scale from 1 to 10 or 0% to 100%, like whatever you want to do, I usually use 1 to 10. And scoring for yourself from 0 or 1 being, yeah, I just don't even know where to begin, to 10 where I'm like, yeah, I'm all there. Yeah, exactly, like pain scale for sure. So the reason why, and I'd love to start interacting with you guys. Yeah, and we're seeing a couple of 3s, 4s. Yeah, sleep 6, 7. That's good. 4, low on unwinding. Yeah. Yeah, 7 to 10 people to feed at home. Yes. How many of us are home I was going to say home takers, home makers as well as nurses? Yeah, we've got lives to run outside of the nurses sphere, right? We're not living at the hospitals anymore. Yeah, next to nothing. Yeah, what is that? Passion? Yeah, 865. I love this. Yeah, Tracy, unfortunately, we can't stop that one. You'll get there. You're getting there. Alrighty, 7 to 8. Fantastic. This is great. So I hope you can start seeing like how having this awareness will help you to start setting goals. And we're going to go into how you can do that next. So the reason why it's important from again, we're here to earn that CPD hour while we're also learning some valuable skills. But the reality is, when we do self-assessment tools, it increases the chance or our readiness to create change. This is again from a study done, or I think in like the 90s, but it stands true today, where if we actually start assessing where we're at, we can actually go, okay, like I can see where I'm at. I'm taking stock. Something needs to change compared with I think I'm all right. And again, from a NMBA perspective, as nurses, we are required to maintain self-awareness so that we can maintain safe practice. I don't know whether they'll agree with my application of it in the personal development space, but it is definitely reality. Because when we have bringing in that awareness is the first step. So you're doing it. You got this. Oh, one more thing to my that's come to mind now with our wheel metaphor visual. Would your life, or does your wheel roll smoothly or wobbly? So again, you can see in our example here, we've got a very wobbly wheel. We might actually get to a point where we actually get stuck because some areas are so out of balance that we actually can't get it to roll over. So yeah, that is just a visual that I keep in mind when I'm assessing, for me, where am I at? And this is the thing, is it's not going to stay the same. It's a dynamic. A flat tire, square wheel. I love that, Elizabeth. Kate, you guys are funny. Oh dear. You guys made me laugh. Now I'm like, I'm gonna have to take a water break. Oh, that was a goodie. Thanks, ladies. Alrighty, so now you can look at how can we action this? Like, right, we've got our self-awareness. How do we move on? What can we do next? So one of those personal development books that I read was who's heard of Atomic Habits? It's a book, a fantastic personal development book about habits. Yes. Oh, good. Yeah. It's a fantastic resource. So if you ever want to read, I can't remember the author's name off the top of my head, but Atomic Habits is a fantastic book. And one of the things that he teaches in there is small steps create sustainable change. And we've got some wheels falling off. Yeah, amazing. Yeah, okay, great. Elizabeth, you've got an audible. And I'm not sure whether it's Michael or Jessica who's joining, but you're reading it now, so that's awesome. What that book teaches, and it is fantastic, he says that sustainable change is created through small steps. And I love that frame that it sets, because sustainable is so important. There's one thing, James Clear. Thanks, Erin. Fantastic. Yes. Did I say Atomic Habits, or did I say, oh yeah, Atomic Habits. Yeah, okay. I was going to say, did I say it wrong? Okay, we just missed the name. Yeah, so James Clear, he talks about that sustainable change. The difference between just doing something versus it actually lasting is sustainability. If you can't maintain it, it's not going to stick around. So being able to set yourself those micro goals, and this is why I love micro action planning. You can't see it because of my background. Micro action planning is setting small enough goals, or at least have a big goal that you break down so tiny that there's almost no way that you can fail. For example, we'll go through each of these areas, and I'll give you like a really simple example, but I want you to start thinking about how you can apply it for you. Just Googled it. Thanks. Dr. Google is great with some things. So some micro example, action examples. For sleep, it could be something as simple as leaving your phone out out of the bedroom. Many of us doom scroll just to feel good before we go to bed. This is where we start looking at our sleep hygiene. One of the things that we do in my house 85% of the time, if I'm honest, is have a charging station in the kitchen. So then we plug it in there, off we go to bed, rather than being like having that temptation right there to scroll, and then you're messing up your your sleep because of the blue light. Other things for nutrition, so preparing one snack for the week or one snack for the day. And often that can look like a protein snack. I highly recommend protein snacks if you're not into them yet. They keep you fuller for longer, and it helps you curb that craving that's just looking at you from the other side of the nursing desk. Can you guys tell, like, I'm a bit of a chocolate fiend? So yeah, I gotta keep those protein snacks in my easy reach. And when we're thinking about movement and habits, if we're looking at habits, and we use movement as an example, it could be something as simple as a 5-minute stretch. I sustained a disc protrusion back injury from rolling a patient, again, early in my career. And I just did like 5-minute stretch exercises in my chair at the nurse's desk. It could be something as simple as that, just to strengthen those core and back muscles was a lifesaver for me in my recovery. Other things that we could be looking at are, when you're looking at your passion, thinking about reconnecting with why you started, and then see how that has changed. And it's about that's a bit more reflective. With goal setting, it could be something simple as looking at just looking at your wheel of life and go, oh, like I want to start improving something, or breaking it down into something more specific, like say, I want to improve my relationships. And then you can break down a smaller goal in there. I feel like I missed one or two. We've got nutrition, we've got habits, we've got sleep. I think we covered all of them. If you want an example for something, then I've missed it, let me know. All right, so I want you to take a second now and write it down. You can drop it in the chat if you want to be kept accountable, but an unwinding example. Okay, unwinding example. I love it. So for me, it was doing it's called, this is from another book. I believe I know he's a doctor, and I want to say it's Dr. Adam, I think. He wrote a book called The Third Space. Fantastic resource for creating distance between two aspects of your life. So that could be the ward and home life, as an example. And it says create a third space between those two spaces. And what that could look like is having a meditation or a breathing exercise or a reflection exercise, could literally be 30 seconds, is creating that third space. We go deeper into this in the Nursing the Nurse members areas and things, because it's a vital skill to learn. But that's another great resource if you want to go in super depth. Is The Third Space by, I believe, Dr. Adam Fraser. I hope that's right. Someone might be able to Google it for us. All right, we've also got passion is about the next generation of nurses. Yeah, I love that. That's really, really good. Oh, yeah. I can actually talk about this forever, so I'm going to refrain from going on to a tangent because it's so important. Anyway, so the moral of the story with this exercise is I want you to realize that small steps done consistently is Dr. Madam Fraser, tick. Small steps done consistently is what's going to lead to burnout, to beating burnout every time. Because if you do small, consistent, it's sustainable. And that's really, really a vital skill to learn. So now you should, and I'd love for you to tell me where are we at, because you now have clarity on which domains are out of balance for you if you've done this exercise. I hope you've connected with why that matters. And you should also have your first step to start shifting that. So who has ticked those boxes? How is everyone feeling about taking action on those? You can say, yes, good. You can rate yourself out of 10, how confident you're feeling to get this started. I love it. Fantastic. Yeah, beautiful. Good. That makes me happy. So I love that you guys have these aspects. You've got some of those, those basic steps. Haven't ticked, but happily going to tick anything that stops the urge. Yeah, great. Fantastic. I love it. You've got these action steps, and that's again, like we said before, self-awareness leading to those first steps. So the real change, and this is something that I don't include in the Wheel of Life, because I usually use the Wheel of Life for clients. because ultimately real change happens when you've got a plan, when you've got accountability, and when you're surrounded by a community who gets it. Ultimately, you can do it by yourself. If you think about a community as a fire, when you remove a coal from that fire, which is going to burn out first, it's often the coal that's by itself. And so having that flame, that fire of people who are on the same page, who are heading in the same direction, there's nothing like it to have that around you. So let me share with you how we can support you after this class. And I really want this to be an opportunity for you to go, yeah, I feel supported and this is what I want to do. So before we head on to that, how are we sitting with the content so far? How are you finding that we've had enough value in here? Have you learned something new? Yeah, amazing. Good. So if you want these types of changes to stick and you don't want to get yourself stuck in that rut of feeling guilty for becoming healthily selfish or continuing down that path of burning out, I want to share with you how we can support you. So I'm going to share my screen again and walk you through something that I'm really, really excited about. So this is the micro changes that we talked about. And yeah, we all need support and accountability. So drum roll, please, because this is about 3 years in the making. So when I first wrote and published my book, I realized that nurses don't necessarily have the time to read. I don't know how I didn't think about that before, but we don't necessarily know what we're doing, not know, but we don't have the time, or we're just like, you're not going to sit down and read a book. So I was like, okay, I know that the resources and the principles that I wrote about in my book is valuable, but I want it to be accessible to nurses so they can actually create that change. And that's when I got the idea to create a holistic huddle. So I want to introduce to you the Holistic Huddle app. This is a really, it's one of my passion projects where I have pulled everything that I know and that I have found in my own journey to help beat burnout, but also incorporated 7 or 6 other experts in their field to help create a one-stop shop for nurses that they can actually create lasting change based on these principles that we talked about today, and then some. So some of the things that you might see in our app, it's accessible on your computer and on your phone. And we've got those 7 core wellness categories. So we've got experts in nervous system regulation. We've got experts in somatic work. We also talk massively about self-awareness and how to move away from those self-care, wishy-washy practices, and more the like, this is actually going to help me look after myself practices. We definitely talk about burnout, how to decompress after shifts. We have nurse-tailored meditation sessions preparing for a shift or debriefing from a shift. We've got all things from exercise sessions that range anywhere from like 10 minutes through to 40 minutes, depending on where your fitness level is. And we've got a fantastic team of nutritionists and dietitians who work with hormonal support, weight loss, blood sugar regulation, including specific, it's not individual tailored, but it is nurse tailored meal plans. So I'm so proud of this because we are now in the beta launch phase of this app. And this is a really special offer because it's actually the first time that we're talking about it in public. So guys, I don't know if you can see it, but I'm so excited because this is the type of resources that I wish I had when I was in the depths of it. I wanted something that I can do in my own time, that I can do when I needed it. And I wanted something that I can just go, I need X topic support today, and it pops up. And that's exactly what the Holistic Huddle app does. So it doesn't end there because we also have a really great monthly live huddle where I show up as your host, but I also bring our experts in on our calls, and they rotate through and just provide you with those Q&A sessions or tidbits on how to get the most out of the app. and apply those skills to you and tailor it to you in those sessions. And even if you can't join live, because again, we've established we can't always join live because we're nurses, you actually can watch the replays. So yeah, again, it's just a resource that I wish I had, in my nursing practice. So our experts, they are from all over the world. We've got some from America, we've got another in Europe, and then we've got about half of us are in WA. So we've got myself. I see myself as the GP of the experts. I'm the generalist with the basic understanding, but then we've got our specialists and our experts, where we've got Sarah. She's a physiotherapist and a Pilates instructor. We've got Dr. Jo Neal. She calls herself a bullyologist because she works on how to create better culture in the workplace. She is a fantastic resource. We've got the Body Balance Nutrition group. They focus heavily on blood sugar control and weight loss. We've got Evelyn. She is our reproductive health from a nutritional point of view expert. Then we've got Trish Gent, who does our nervous system regulation, and Jessie. She's also actually a doctor, so I actually didn't acknowledge her doctorship there, but she's a physiotherapist and she focuses on somatic healing as well. So the reason why I wanted to share that with you today is because usually we're going to be charging a set fee, but before I get into that, actually I'll just show you what it looks like on the inside. So when you log in, I actually have just taken a little video, and this is what all the resources that you'll have available to yourself, and it's continually growing. So it is just so beautiful, and I'm just so excited for where it's going. So yeah, heaps and heaps, and there's more coming. All right, so usually we are going to be charging about $30 a month for this, which, if you think about it, if you were to go see a physiotherapist and a nutritionist by themselves, that would definitely cost you more than that. But because you guys have joined through the NPAA, we have actually decided to give you a 30-day free trial. So you absolutely can give it a go. You've got access to everything. And look, if you don't love it, if you love it, we'd love for you to stay. And if you don't, just cancel it. Ultimately, I want it to be a resource that you enjoy and that you love as much as I love, rather than feeling like you're stuck into something. So because you are here, you'll get 30 days free. And for those watching the recording, this is absolutely still available to you as well. And look, for those who join in the next few days, or as long as this video is up and available as a recording, you will be considered a founding member. And so what that means is you actually won't ever have any price increases of this of your fee for as long as you remain a member. And because we really want to value those people who are ready to take action now, and who are ready to create the change that we know that you can get. So yeah. So before we wrap up, I'd love to open up for questions, whether that is about our content that we talked about today or the app. We'll ask questions. We've got one last thing to do, and then you're free to go. So hit away. Jordan's going to help me monitor. So if there's any questions that I've missed, then yeah, we'll go from there. So if you want to ask a question, either raise your hand and we'll unmute you, or do a raise your hand, react, and again, we'll unmute you and we'll go from there. If you don't want to talk, you can pop it in the chat and I'll read it out and answer.
I'm not sure if you addressed this already, but somebody asked about mentorship type help, if that's something that you're offering.
So I guess the question would be, what type of mentorship? Do you mean in career progression, or do you mean from a health and wellbeing point of view? Because that will determine how I answer the rest. Oh, thanks, Nikki. She says, so refreshing to see a young nurse passionate about nursing self-care. Yes, it is what I live for. If we talk about passion, that's like on a scale of 11 out of 10 for me. It's something that I get really fired up about. Yeah, wonderful. We've got a couple people who are ready to check it out. The Holistic Huddle. Awesome. Thank you so much for your support. Alan, thank you so much for addressing and providing solutions for the elephant in the room. Look, I truly hope so, because this is, like I said, it's about 2 to 3 years in the making, where it's just been looking at what is out there and what we really need. Awesome. Just a couple of thank yous. Oh, you're very welcome. It's been amazing to be here, and I've loved interacting with you guys. So thank you so much. All right, I'll just scroll back. Jordan, was it Colette?
Yeah, it was Colette.
Colette, if you're still here, we'd love to know, yeah, what you're looking at. Would be great to have a look at the app before committing. Yeah, look, so you are absolutely able to check it out, Alan. If you don't want to commit and you want to see the app before you join, so it is 30 days free. You basically just create your account, you check it out. If you don't love it, just cancel it. And by the 30 days, you won't have access anymore and you won't be charged either. But if you love it, stick around. Clarifying the subscription. Can it be claimed with the ATO as CPD? Look, we haven't gone through the standardized, like making sure that it's up to standard. It's definitely something we want to do eventually, but it's not guaranteed yet. So if you want to do that manually, you could, and make sure that it does tick those boxes, but we don't have CPD certificates yet. Again, it's our beta launch, so it's definitely something that is coming. We've got, is there a way to connect with you like email? Yeah, absolutely. You can email me at hello@nursingthenurse.com. I can type that in for you. And if you've got any questions or you need any support, we'd love to hear from you there. Let me scroll back. All right, Bernadette, yep, I see that Jordan's answered your question there about how you can watch the rest of the webinar. Yes, please watch the replay. We'd love for you to check that out.
You also
Amazing.
receive an email, follow-up email with a link directly to the landing page for Janelle's app. So if you have any questions, you can reach out and respond to us via email.
For sure, absolutely. And Angela, thank you so much. It's been amazing. Beautiful. The session was very impactful. Thank you so much. That's perfect. That fills my cup. Thank you, guys. Elizabeth, really need to support each other and stop the current culture for sure. My goodness. And Dr. Jo Neal is our bullyologist. She's fantastic for that. She's got a really beautiful story that she tells about her experience as a scrub nurse, and how she, in reflection, should have gone over it. Yeah. Having a look at the app sounds helpful, interesting. Fantastic, Martin. Yes, please let me know what you think. Alrighty, Janine, I would like to see huddles and or gatherings with other nurses like today, not necessarily needing to buy something each time, but something we can banter to as yeah, so this is one of the things that we hope to achieve in those holistic huddle or those live huddle calls that we will have monthly in the holistic huddle app. You can come with your questions, you can come with your stories. Sometimes we laugh, sometimes we cry, but almost every time someone walks away and hears something that they just needed to know. So this was in our pre-beta testing group. It's so impactful just to be able to, have a chat about these things. All right, we've got the replay will be in a YouTube link. And I believe it might be, depending on the length of it, they might also upload it to the NPAA Nurses Academy. So that could be great. Amazing. Another scrub nurse from Angela. Amazing. All righty. Great. So if there's any other questions, I will get back to them in a second. But before we wrap up, I just want to share one last really exciting thing. And that is that tomorrow or in the next few days, you'll be contacted with an exclusive offer by the NPAA. They've put together something really special for those who have attended the webinar. So please do keep an eye out for that in your inboxes. So that'd be really great. For those who are claiming CPD, you will have access to the reflection questions, and I believe they'll also be sending you a link to get your CPD certificate. So that'd be really good for you if you want to, take advantage of that. Yeah, like I said on this little slide, you deserve to thrive, not just survive. So that is my goal for you, whether you've walked away with some actionable steps or whether you're going to be joining us in the Huddle app. We would, we're here to support you both, Nursing the Nurse and the NPAA. So yeah, thank you so much for having me. We'll keep the chat open for the next 5 to 10 minutes. If you've got any other questions, you're welcome to jump off mute if you want to actually have a chat. But otherwise, that wraps us up. Oh, okay. So I can see that, Kate, you're asking, what if you're already burnt out? So that's the holistic huddle is for you and for anyone at any stage of burnout. So whether you feel like you're already in the down in the dumps, we've got tools that is going to support you from there and hopefully be building you up. And again, those live huddles are fantastic. Even if you just jump on, mute, put your camera off, and you're just in the background listening, you might hear something that goes, yeah, I needed to hear that today. Yeah, so there is definitely some free burnout support from the Nurse Midwife Health Program. Thank you for sharing, Tanya. They are really a great resource. Alrighty. Abo cruise with similar content for CBD. I'm unsure what you mean there, Bernadette. Was that a joke or was that a reference to something? Because I'm not sure. All right, so it's not an app. I'm seeing that it's someone asked they're unable to find the app on the App Store, so it's not on the App Store just yet because we're in beta phase. So it is a web run app currently. So if you go to Holistic Huddle website, which is nursingthenurse.com/HH, I believe Jordan should be able to share that for you there, so you can check it out. Amazing. I'm glad you guys found support and found it useful. Amazing. Yeah, beautiful. Look, those reflection questions are really for you. So if it's okay if you can't fill it out in the doc. You might be able to print it out or download a PDF editable version of it. And then just keep that for your own records. I'm not sure to claim your CPD certificate, Jordan, you might want to shed some light on how people do that and I guess prove their attendance or.
Yes, so we'll be sending out a follow-up email tomorrow or the next day with a link to request your CPD certificate. And then if you're not a member of the NPAA, we'll be also reaching out with a phone call just to verify your attendance.
Yeah, awesome. Cool. Any other questions? Comments? Yeah, so it won't be on any it won't be on any app places. So it won't be on Google, it won't be on the what is it called, Play Store, and it won't be on App Store because we're in beta phase of the app at the moment. But like I said, it will be on the website there. So yeah, nursingthenurse.com/HH, standing for Holistic Huddle. And then you've got the email as well if you have any questions, is hello@nursingthenurse.com. And of course, you will be getting all those resource links in an email from NPAA soon and or tomorrow. It has been so wonderful, guys. Thank you so much. If we don't have any other questions or comments, that is us wrapped up. But please reach out. We are on all the socials. Both myself as Nursing the Nurse and the NPAA, and we're here to support you guys. So thank you so much. It's awesome. Thanks, everyone.